up Jason DeRusha. Let's hear what they have to say.
Thank you. Please go ahead.
Thank you for joining us for the COVID-19 media call for November 2nd. We'll start today's call with comments from Health Commissioner Jen Malcolm and MDH Infectious Disease Director Chris Ayers. We'll then open up for questions from reporters on the line. With that, we'll now turn it over to Commissioner Malcolm.
Thank you, Mike, and good afternoon, everyone. Well, the United States hit another unfortunate milestone on Friday, recording its first day of over 100,000 cases in a single day. And unfortunately now over 231,000 people in the United States have died from COVID-19. Minnesota, we're reporting today an additional 2,954 new positive cases from 37,429 tests that came in on Sunday. With Friday's 3,004 new cases that were reported Saturday and the 2,211 from Saturday that were reported yesterday, this means that just since our last call on Friday, Minnesota has added more than 8,000 COVID cases. We now have had 153,620 laboratory confirmed cases in Minnesota since the beginning of the pandemic. And since our last call Friday, another 47 of our fellow Minnesotans have died. We reported 18 deaths on Sunday and 20 deaths on Saturday, another 9 today. Since the beginning of the pandemic here, we've lost 2,463 of our family members, friends, colleagues, and neighbors to this virus. And since the beginning of the pandemic in Minnesota, there have been a total of 10,437 patients hospitalized, 2,729 of whom have received intensive care. Friday, we hit another high watermark for hospitalizations at 772 persons in the hospital on that day, with a decrease on Saturday and a slight increase yesterday, with 748 Minnesotans currently hospitalized for COVID, 182 in intensive care units. I just want to note, as we have before on the calls occasionally, that there is some variability in the number of cases reported on any given single day. This is due to the volumes of incoming laboratory reports, workflow, staffing, occasional data cleanup, and periodic information technology issues, which does not mean that the data is lost or incorrect. It just means that sometimes some of the new cases we would have reported on one day end up being reported a day or two later. That was the case with yesterday's somewhat lower count, which you see reflected in the numbers for today and tomorrow as well. I only mention this as a reminder that while any given day's numbers may grab attention, it's really the weekly and longer term patterns that are more useful for tracking where we are with the pandemic and what the trends look to be going forward. Testing continues to be strong and growing week over week. The case growth is even faster. The weekly change in cases is now 13.5% from yesterday, from a week ago today to today, up from 8.9% the week prior. The change in cases, though, is almost double the change in testing, which is an increase of 7.4% since last week versus 7.2% the week before that. The 7-day average testing positivity rate has climbed over 8%. It's now 8.1%, which is based on data just through October 24th. We've talked before about the 1 week lag period that we allow for data to come in and be complete. So this 8.1% test positivity rate does not include the most recent week of record high case counts. We know that this test positivity rate is going to continue to climb through this week. Antigen tests, or probable cases, continue to represent a small share of the totals. For instance, there were 18 probable cases through antigen testing on a volume of 298 antigen tests in yesterday's significant laboratory total. So that's just important. We will continue to report on antigen PCR tests separately, but the antigen volume is not at this point influencing any of the calculations particularly. We saw 95 total workplace outbreaks in that last week before the last period. So in the week of October 24th, which was up 76% from the previous high that we had seen in other weeks. We saw more outbreaks in a wider range of manufacturing plants, not just food processing plants, with a high number of outbreaks in other workplaces like retail and offices. A workplace outbreak counts the cases of employees and not any customers or patrons of that particular place. So for instance, restaurant employees are counted in a workplace outbreak, but the people dining at the restaurant, which is counted in a community outbreak summary. Just a quick note on bars and restaurants that we've talked about a number of times in recent weeks. So far, we've had 172 investigations at 161 establishments, accounting for 3,185 primary cases. 74 of those establishments met the outbreak threshold of at least 7 cases attributed to one establishment, with 2,220 primary cases. And noting again, as we said before, that these primary cases do not reflect the subsequent waves of further transmission, which grow to affect tens of thousands of people from those initial primary cases. Just another word on healthcare workers, which we've also talked about a lot in recent days. It should be really sobering to all of us that is among healthcare workers, the people fighting this virus, the front lines and caring for us all every day, are growing quite rapidly. And as we've said before, they're getting exposed in the community at a faster rate than they are at work, where so many of them have up close contact with very ill people. We continue to worry about the exposure our workers have when they are out in the community, given these large numbers of community spread and community transmission. And just to make this point once again, it's just not one or two big notable events that's causing this incredibly high level of community spread. It's the happy hour at the end of the long with just a couple friends, or brunch on the weekend with a few cousins, maybe some aunts and uncles. It's the weddings. Everybody really tries hard during this to comply with the safety guidance and much reception. But as the night wears on, people start letting their guards down. These are the scenarios driving spread, and the data bears it out. People get exposed to this virus when they're out and about, from people who know they have it, and other people take it home. And that silent spread gets into our schools, or long-term care, and into our hospitals. Talked about the fact that with hospitalizations going up, so far our hospital capacity is holding up. It can change quite quickly, and can change likely due to staff shortages, as we have seen and are seeing every day all around us in states and countries. And if our healthcare workers can't avoid the virus outside of work, they can't be at work taking care of people when they're sick. So the good news is that we can do something about it. But we all need to understand one thing. If we're wondering what somebody else is going to do to fix this COVID problem, we're missing the point. The question we all need to be asking is what we're going to do to change our behavior today to reduce the alarming speed at which the disease is now spreading among our family, our neighbors, our friends, and all Minnesotans in every part of the state. We can all keep part to keep hospital beds available for those who need them, keep doctors and nurses on the job, keep our schools open by doing the basics, wearing a mask, avoiding large crowds, keeping our space from other people, getting a test if we have symptoms, if we've been exposed, or if you're recommended to be tested. With that, I'd like to pass it off to Chris Bearsman for some additional comments.
Thank you, Commissioner. To just go a little bit deeper into some of the issues that the Commissioner mentioned. We mentioned our current statewide positivity rate of 8.1%. 47 counties were at or above 5% of test positive in week 42. So that's more than the week before. And 9 counties were at or above 10% of test positivity, which is 7 more than the week prior. And Red Lake County is over 15% of test positive. So we are seeing increasing positivity rates that are very concerning. People often say, oh, if you test more, you're going to find more cases. But as you're seeing, it's not the testing that's the problem. Testing is helping us to identify cases early, but it's the sheer fact that we have so much virus circulating in our state. We also have regional and county level data on case growth. And all of the top 12 counties with the highest per capita number of cases in the past 3 weeks continue to be outside of the metro area. And in particular, we're seeing this in southwestern Minnesota. And of interest and concern is that we are not seeing these increases due to any particular cause. So in other words, southwestern Minnesota doesn't have a particular workplace or school or jail or long-term care facility outbreak. It's simply experiencing spread from events in neighboring states and the communities. So we want people to realize, again, that these high numbers of cases that we're seeing cannot be attributed to a particular event to say, oh, well, you know what? It's because everyone attended X or did Y. No, it is absolutely due to widespread transmission across all sectors and across the community. Across the state, we're increasingly concerned about people not wanting to share details with our case investigators about their recent interactions or activities. This makes it harder for us to get the potential high-risk contacts who may go on to get COVID and pass it on to others. This just accelerates the spread that we're seeing even more. That's why we desperately need all Minnesotans to help us. In addition to what we talked about with masking, physical distancing, staying home when sick, avoiding large groups, we need all of us to provide key information to our case investigators so that we can help protect your friends, your family, and your community members. Answering the questions we ask means that you help reduce the risk to those around you. The takeaway for today is that Minnesota is in a bad spot due to rapid community spread of COVID-19. It's going to get worse before it gets better. It's up to all of us, all 5.5 million Minnesotans, now determine whether we will be the crisis of our neighboring states like Wisconsin, or if we will collectively make the right decisions and slow down the spread. With that sobering news, I'd like to acknowledge that we saw some hopeful signs over the weekend, with many people choosing to modify their Halloween celebrations to emphasize lower risk activities. And I can tell you that even within my circle, and trust me, not everyone in my circle does everything that we recommend at the health department, but in my neighborhood and the things that I saw on social media, people were very creative, putting treats out on tables and bags, putting bags on little poles in the boulevard so you could just pull up a flag that had a treat on it, creating a large PVC tube that went from the second floor patio or balcony area down to where the kids were trick-or-treating. So when kids would come, they could get their treat through this pipe with contact. The creativity was enormous, and it was really encouraging to see, because it showed to me that the ingenuity that we have, and when we want to do the right thing, we really can do it. So we're really encouraged by the positive changes, and I just want to reiterate how important it is that we continue in that vein and continue to do everything we can to decrease the risk in our state. And with that, I'll turn it over to Mike.
Thanks, Chris. Operator, we're ready to take questions.
As a reminder,
To ask a question, you need to press star one on your telephone. For your question, press the pound key. Your first question, Jeremy Olson with the Star Tribune.
Hi, I'd like to ask a couple questions comparing Minnesota with Wisconsin right now. I mean, there was a period of time in the spring and early summer when we were looking at Wisconsin and wondering how they were doing it. And now we're looking at Wisconsin and wondering how we cannot be them. It doesn't make sense because we're demographically similar. Do you have any sense looking at this why we've had such arcs in the COVID pandemic, our states?
This is Commissioner Malcolm. I'll just comment briefly and then ask Chris for her perspectives. You're right. We've kind of been back and forth with different trends at different times in our two states. Certainly, the fact that a lot of decision making has been at the local level in Wisconsin after the Wisconsin Supreme Court invalidated the governor's statewide approaches could be part of the issue. The fact that we have a significantly more dense metropolitan area in the Twin Cities, we think is another part of our early challenge here. But I think I'll turn it over to Chris and see what she would add.
Thanks, Commissioner. Well, Jeremy, a couple of things I'll comment on. One, in addition to everything that the Commissioner said, as you know, in the spring in Minnesota, we had a very targeted test. We had limited testing, and it was very targeted to our elder and high-risk population. So we were very much following outbreaks in our long-term care facilities at that time. And so that certainly was contributing to the picture that we were seeing in Minnesota. And at this point, I would say that while we're looking better than Wisconsin is right at this moment, we see ourselves going down that path. We will very much not be in the same place potentially in a few weeks. And we will not have any advantage over our neighboring state. And so that's why we are so very concerned. And that's why we keep sounding the alarm to indicate that we really need all Minnesotans to be taking this very seriously. It's not a competition between the states. We want to learn what we can from our partners in Wisconsin, but we want to recognize that we are in a very precarious place in Minnesota, and it won't take too much to have us exactly the same place that our neighbors in Wisconsin are.
Well, just to follow up on that a little bit, it was last Monday when the government issued this goal line stand analogy and discussed about trying to prevent us from being like our neighbor states, which are having such high rates. I guess a week later, is that still a goal? Later last week, you said we're starting to see a lot more similarity with our border states. I guess I'm wondering if that's even possible at this point.
Well, we sure hope so. I think as you know, it takes a couple of weeks for any kind of change in the pattern on the upstream behavioral side to really manifest in differences in the numbers. But we are hopeful if Minnesotans can, as the governor said, kind of double down and take that goal line, that we might start to see the effects of that in another couple of weeks. But it is certainly sobering, I think we are very mindful of the difficulty of isolating our state from what's happening in other states.
Thank you.
Your next question, line of Catherine Richard with Minnesota Public Radio.
Okay, so you mentioned earlier that more and more healthcare workers are not on the job because of either quarantining or having COVID. Do you have a number right now statewide of how many are out?
Chris, do you happen to have that data handy?
I can tell you how many people that are currently being monitored. So we have our monitoring team that is looking at the number of staff who are being monitored, and can tell you that, as September, so now we just have moved out of October, so we should have those numbers soon. In September, we had 1,039 healthcare workers who had high risk exposures, which means that they would need to be quarantined and monitored. And the number had increased each month in June. So I would expect that we would have well over 1,000 cases in October that we were monitoring.
Okay. And to that end, we keep hearing you say healthcare workers are getting COVID while in the community at things like weddings and funerals. That's how people seem to be contracting it in general these days. Have you made any additional effort to regulate weddings and funerals? Have you reached out to churches asking them to pull back on these activities? And it also raises the question of whether these activities, are sort of falling within the state guidelines, and yet people are still getting the virus.
Very good questions. This is Commissioner Malcolm. I think in general, certainly there have been some events that we know have operated outside the current guidelines. And that's why we just keep really reminding people not only what the current guidelines are, but with the degree of viral activity that we see and the degree of community spread, that we're encouraging people to be even more careful than the guidelines. And it's part of what we look at. We're kind of monitoring how are other states evolving their guidance, and looking at just how can we do a better job of communicating the risk level that's out there.
Yes, I'm sorry. Just to be clear, I was wondering also, whether there's really any way the state can regulate something like a wedding or a funeral. I mean, do you have any actual jurisdiction over events like that?
Well, I think it is in the context of the governor's executive orders, which do set capacity limits for venues and events like celebrations. So, our main tool is education, and it's really reaching out to the relevant sectors, and making sure that the providers, the operators of venues, and Minnesotans in general know how important gathering limits are. As we do continue to look at those gathering guidance limits in the light of the viral transmission. So we're continuing to just discuss that.
Well, and sure, if I could add too, I think one thing that we have heard from some of the operators of these establishments is that while they are trying to follow the guidelines set forth in executive orders, oftentimes the host of the event will not be following their instructions and will be ignoring the guidance, and it puts them as an operator in a really challenging position as well. So I think it once again speaks to the fact that we need people to be following the guidance themselves. We can regulate, we can try and put more things in place, but simply just doing it, we've asked, masking and maintaining social distancing would be huge and would certainly keep us from having to take action that would be stronger. And I think that's the goal that we would like to see.
Okay, thank you.
Your next question, line of Chris Megan with Pioneer Press.
Hi, thanks. I wanted to follow up on something you mentioned about contact tracing. Just with 3,000 cases a day, how are you even able to attempt to contact trace? What type of a staff do you have in that work? And how prevalent is the sort of resistance to answer all the questions?
I'm going to ask Chris to comment on that in detail, but just a thanks to all the public health workers at the state health department, at local health departments that are working feverishly to try to keep up with this pace. And it is daunting. Folks are putting in a great deal of effort. And Chris mentioned one of the concerns is not just the volume and how much work it takes to keep up with it, but just the value of the information that comes out, either from people not being willing to share the information, which is a real concern, but also just because so many people genuinely have no idea where they have gotten exposed because they've been in a number of events, and that they're getting it, as we've talked multiple times, from other folks who don't themselves know they have it. They don't have any symptoms or very mild symptoms. So the process tends to yield less valuable information. Certainly very valuable when we can identify contacts and warn them, but just less actual information coming out when people don't know where they got it. Chris?
Yeah, so we definitely have been working with partners to increase staffing for case investigation and contact tracing. So we are continuously bringing on new staff to assist with the process. And we've been doing this for weeks, and we anticipate that we will continue to do that. We oftentimes will send out an call alert to all the staff who are working on many different aspects of the response to say, we need assistance right now with a particular aspect of our case intake or things that contribute to making us ready to do our case investigation and contact tracing work. I think we're also looking at the fact that as the pandemic has progressed, what have we learned and how can we modify how we're doing this work to be more efficient? How can we get the information that we need to be able to do a public health response in a more efficient manner? So all of our teams have been meeting to look at how they can do that, because I think, as you know, in addition to the individuals who are doing case investigation and the contact tracing, we have long-term care teams, we have correctional teams, we have school teams, we have healthcare worker teams. We have all these teams that then do the deeper dive follow-up. And so we've been talking about, okay, what is the core information that we need to get out of the interviews, and how can we increase our efficiencies so that we get what we need to do our response, but we minimize the time spent on each individual situation. So definitely, you're right to acknowledge the increase in cases. And I appreciate the commissioner's acknowledgement of the teams that are doing this. This is at the state level, at the local level. People are putting in a huge amount of work to reach out to all these cases. And we're looking at, as I said, we're looking at ways that we can do this in a more efficient manner to get the data we need, but to ensure that we're doing the appropriate public health follow-up.
Thanks. Is there any way you can ballpark the number of folks that are working to do this type of work, this type of research?
Oh, yes, I'm sorry. We're talking about hundreds of staff. So 500 staff at least doing this.
And then just the prevalence of people resisting the questions. I mean, is that 1 in 10 or 5 in 10?
I think a more fair would probably be about 35% of people are expressing reluctance to share details. And we've seen that increase over the course of the pandemic. Yeah.
Operator, we have time for one more question.
And your final currently with Jeff Wagner with WCCO. Mr. Wagner, your line is open. You may speak.
Hi, we wanted to just ask, how concerned is MDH right now regarding the Stillwater prison outbreak? We have, roughly half inmates testing positive, 140 staff, and then just recently an death. So what is the level of concern? And then what is usually behind the rise in this case number? What are the efforts going on right now to stop it?
Commissioner, are you speaking or do you?
Yeah,
want me
thank
to-
you. Thank you, Chris. I was intending to hand it off to you, but I was just going to say again, just a note of the significant effort and the diligence that's gone into working closely between MDH and the Corrections Department on testing aggressively in these facilities and helping to try to limit the spread. These challenging facilities, many of the older don't lend themselves as well to the kind of separation practices that are optimal. But Chris, I'll let you speak to some of the data.
Thank you. Yes, I mean, we're definitely very concerned about what we've been seeing happening in our correctional facilities. And just to be clear, the team that we have at MDH that's working on corrections has been working with our partners at the Department of Corrections since the beginning of the pandemic. And so they are very well connected and very much in tune, for instance, with the situations that you're describing, particularly at Stillwater. They've had daily calls, even over the weekend to look at the situation. And, what we see is that we see cases introduced, usually through staff. And as we've talked about, we are seeing, it as a result of the community transmission that we are seeing. But our partners in corrections have been doing ongoing point prevalence surveys. And what that is they will continue to do point in time testing or checking within their facilities. So they'll test everyone to proactively potentially identify positive cases. So they have been taking this very seriously since the start of the pandemic. And what we're seeing, as the commissioner alluded to, is that there are a number of facilities within the system that are very old, and their physical environment does not lend itself to this, airflow, to being able to isolate people easily. And so that puts a lot of challenges on the corrections team as they're working to deal with these situations. So I would say, yes, we take it very seriously. And in fact, our teams have been working together since the start of the pandemic. And during this really difficult time, they're meeting and discussing the situation every single day. But the challenge is the facilities and the ability to be able to isolate and take action. They're limited to actions that may not be as ideal because of the physical setting that these cases are happening in.
Thank you. All right, that is all the time we have for this afternoon. We invite reporters with additional questions to reach out to our office this afternoon. Have a good day, and we will be back with you.